Ascites or the waterbury is a condition that is hard to treat and unfortunately has high mortality rate. I'm going to teach you ways to prevent the waterbury disease. I will also teach you how the disease works and how it affects your chickens. Lastly, I will let you know how this condition can be managed. So if this is your first time of watching our videos, do ensure you hit that subscribe button and also hit the bell notification so that you get notified each time we post a new video in this channel. The disease is characterized by, presence of swollen abdomen. Chickens with ascites will develop a large amount of fluid in their abdominal cavity. The fluid from the liver will, fill the abdomen, creating a waterbury appearance. Also, birds with ascites will often show symptoms of fatigue and, reduced growth due to the lack of oxygen. Lastly, waterbury in chickens will cause the birds to have a blue wattle and combs, as the oxygen available is given to the more important organs. The less important wattles and combs will turn blue due to lack of enough oxygen. I've also mentioned that ascites comes with a high mortality rate. Birds that have waterbury can eventually die from the disease. Number one is the goat and waterbury. Ascites is most commonly seen in poultry that grows quickly. It's commonly seen in meat birds with rapid growth rates like the Cornish crosses. The disease is caused by the inability of birds' hearts and lungs to deliver enough oxygen to the other organs and tissues of the body. Number two is the elevation and ascites. Farms that are located at high elevation have a lower amount of oxygen available in the air. This puts a normal heart and lung under a stress to deliver enough oxygen to the body system of the birds. Number three is the respiratory disease and the waterbury. Respiratory disease can cause ascites in birds. A respiratory disease will decrease the effectiveness of the lungs. They also cause the lungs to struggle to get oxygen to the organs. And some other causes or some other possible causes of these ascites include: ascites may also be caused by poor nutrition or genetics. Some birds may be genetically predisposed to develop the disease. They may have hearts and lungs that are not as strong and struggle to deliver the oxygen. Some studies have also shown that certain vitamins and mineral deficiency can also lead to the waterbury disease. The waterbury in chicken is easier to prevent than to treat, and there are two main ways to prevent ascites from developing in chickens. Number one is through the environment, and number two is through the chicken's diet and nutrition. The first thing that you want to do is to check and make sure that you aren't living in an area of high elevation. If you live where the oxygen is thin, you may have issues with waterbury developing in your chickens. Also, make sure that your chickens have good ventilation. The house or the pen where your chickens are should be well ventilated. Clean, fresh air will also help to reduce the number of bacteria or viruses that will cause the respiratory disease. Number one is that you should always make sure that your chickens have access to clean food and water at all times. Remove any stagnant water. Number two is that you should also remove old feed or wet feed daily. Moldy feed can cause illness, so ensure that your chickens are getting a properly balanced diet that is intended for the chicken. Don't ever try to feed chickens dog feed or dogs chicken feed. Number three is that one of the reasons that meat chickens develop waterbury is due to their rapid growth. You can slow the growth to reduce ascites. Even a slight reduction in growth will decrease the incidence of waterbury in your flock. You can also reduce the amount of growth by either providing feed with smaller amounts of energy or by reducing the amount of feed. For example, if you are feeding a grower feed that is 26% protein and your chickens keep developing ascites, you can lower it down to 24 or even 22% protein feed. They will still grow faster, but they shouldn't develop waterbury disease at the same time. Unfortunately, ascites is hard to treat. There is no permanent solution that is, approved to treat waterbury disease. But you can call your vet, or you can go to the local feed supply store and, get a medication that will cure it. But there are some methods that have, a promising result that are being, researched that you could try. If you have a bird that develops ascites, you may want to try some of these natural cures for the waterbury disease. Number one is by draining waterbury in a chicken. When you call your veterinary about waterbury in chickens, they are likely to tell you that you can drain the fluid from the swollen abdomen in chickens with waterbury. They can use a needle and syringe to remove the buildup of fluids from the liver. Just keep in mind that this will make the bed more comfortable, but it's not a permanent solution. It must also be repeated as the food will continue to build up. As I have mentioned before, there is no medication or cures that can treat ascites, but there are some natural treatments that are being researched that are showing some promising results. Number one is the oregano essential oil. In a research that was conducted on chickens with ascites, it shows that this oil reduced the cases of mortality rates in broiler birds by 59%. So it's essential to feed birds that could develop ascites with the oregano essential oil as a precaution. Number two is the vitamin C. The vitamin C has, it has been shown to reduce the incidence of waterbury, and it may be, another possible treatment for the ascites in chickens. The vitamin C is, thought to, improve the efficiency of the digestive tract and cause less stress on the bird's body. This truly depends on the condition of the bird and if it is treated or not. A few chickens that are caught early can have the ascites remedied. Birds with advanced ascites may not totally recover. Some that are treated by having the fluid removed can live up to several months, but generally in a deteriorating condition. Ascites is not an infection, so the meat is safe to eat. You may notice when you butcher your meat chickens that some of them have developed the condition and didn't show outward signs before being slaughtered.